So 150 to 300 we will run like Shatabdi Express. Water view you all know for the maxillary sinus, and you can see the opacification of the maxillary sinus on water view. It is the occipito-mental view, right? So this is how occipit towards mentum you do the what is occipit and mentum is a view. Tracheostomy, one of the indications is a foreign body obstructing the airway is a way by which you need to rescue the person. Thickened nerve shown is basically a great auricular nerve. Then Calvel's view, once more examiner is favorite, all old questions. So typically is frontal sinus देखने के लिए, if you are passing a beam like this, you can see the frontal sinuses very clearly, not these are orbits, frontal sinuses very clearly, right? So occipitofrontal is a radiographic view to see the frontal sinuses. Presbyopic correction is done for +3 diopters in old patients. Astigmatism in a emmetropic eye of elderly person, astigmatism contributes until how many diopters? Up to 3 diopters. Then 100-day glaucoma, one of the favorite questions of examiner. Central retinal vein occlusion is also called 100-day glaucoma. Now CR vivo, CR evo. There are the two topics. Where do you find the cattle truck appearance? All these things you have to study. CR evo, CR vivo. If you look at ophthalmology, top 20 topics. Then why it is called 100-day glaucoma? Because in CR vivo there is a development of a hemorrhagic glaucoma. It takes at least 3 months of time, which is about 90 days. That's the reason called 100-day glaucoma. So where do you see rod spots, doc? There are those flame-shaped hemorrhages seen in infective endocarditis, SLE, leukemia, HIV, retinopathy. What are yoke muscles? Whenever you are looking that side, then one side eye must elevate, other side eye must pull you up. So together by a coordinated action you can see. That's called yoke muscles. So contralaterally paired extraocular muscles, they will work synergistically to enable you to have a gaze towards a particular direction, are called yoke muscles. Right side superior rectus and left side inferior oblique work together. Left side superior rectus and right side inferior oblique work together to elevate the eye in this direction. Similarly, the different muscles are all yoke muscles. Strabismus is one of the high yield topic in the top 20 topics. Convergent, divergent strabismus, primary deviation, secondary deviation, where is it more, etc., etc. Amblyopia is another very high yield topic in the top 20 topics. We have an excellent teacher, Dr. Rajaratnam, is a teaches ophthalmology like once for the river Ganges. So we have all her videos on the umedico and anatomy2medicine.com. So you can always review, and also shortly when our session starts she will be coming. Neisseria leads to very severe conjunctivitis, ultimately leading to the development of the destruction of the cornea, ulcerative keratitis. Simple myopic astigmatism may, what is the type of prescription? Impossible MCQ unless you have done a diploma ophthalmology and once were preparing for MD. So simple hyperopia, the prescription will be plus sphere. Simple myopia, negative sphere. Myopic astigmatism, plano negative. Then simple hyperopic will be plus. Then compound hyperopic, etc., etc. I leave the literature for you. But too much a question. Too practical ophthalmology, which we hardly attended 15 days posting. Now, blowout fracture of the orbit, all of you know that it is the floor which is being blown out, and a teardrop sign is what you typically see in blowout fracture. What is this type of retractor? Once more, सर्जरी में कुछ भी करने नहीं देते, देखने के लिए भी कोशिश करते, बाद में इंटरेस्ट चले जाते, निकल जाते, right? So in housemanship, when surgery posting is there, we will be sitting and preparing for entrance. So actual exposure is a challenge. So there's a reason, doc. Morris de do bolke surgeon will be asking the nurse, right? Only nurse knows where is the Morris. So typically, if you want to get a good exposure to separate it, you will be using the Morris. So what you have is a catgut plain suture. Is it absorbable or non-absorbable is the question here. So you should know suture classification very clearly. Absorbable, non-absorbable, that's synthetic and natural. And similarly, non-absorbable means synthetic and natural. I leave the literature for you. Van Nuys prognostic index is one of the favorite old question of AIMS All India Question Bank. So it is the margin, size, age, which are the ones which are the main part of the classification. Worldwide, it is the alcohol most common cause of pancreatitis. Then with regard to the keloid, typically there is a transforming growth factor beta which has got a role in the keloid. Whenever you are cutting and doing fasciotomy, what are you cutting? You are cutting the skin, subcutaneous tissue, superficial fascia, deep fascia. All these structures are the ones which you are basically cutting. Crohn versus ulcerative colitis, age-old question. Skip lesions are a feature of Crohn, but a continuous involvement starting in the colon, beginning in the rectum, is the one which is ulcerative colitis. Carcinoma head of the pancreas, if you want to detect, you try to do either an ultrasound or a CT guided needle biopsy, which is considered to be the most definitive way of detecting the head of the pancreas tumor. Abdominal mass in that hypertrophic pyloric stenosis, typically end of the feeding. During the feeding is the time where you can see the presence of the peristaltic activity trying to push the gut, will make you to feel it during the feeding. Now, one Glasgow coma scale, at least one Ranson's criteria, we have to calculate in exam hall. White paper chahiye kya? Ek bundle. Mental calculation. So, you have to calculate using that calculation in this given case. What is the answer? It is 11. Maximum score is 15, but minimum is 3. Red proto-oncogene is that one which you see on medullary carcinoma of thyroid. Then abdominal aneurysm, so it is, what is the most common way you detect abdominal aortic aneurysm? Completely asymptomatic patient में, elderly man में ultrasound करे तो और कोई reason के लिए aortic aneurysm मिलता. That's very common way. Elderly people above 65, 70. You won't jump and start doing operation for everybody. Unless the size of the aortic aneurysm is more than 5.5 centimeters, that is the cutoff for surgery of abdominal aortic aneurysm is what you need to remember. D. Quervain Tenosynovitis. What are the two important tendons involved? Extensor pollicis brevis and abductor pollicis longus. The thumb-wala tendons are the ones which are affected. The patient has a history of road traffic accident and X-ray showing the presence of onion skinning. Onion skinning is a feature which you see in case of chronic osteomyelitis, is what you need to remember. What is a lunate dislocation? Perilunate dislocation. Super duper question. That 30 questions I said no, थोड़ा brainy questions उसमें आता है. ऐसे questions में you can jump to answer them, and if you answer them, you will have a very good mileage over the remaining aspirants, definitely. Normally this is the orientation. You are having radius, you are having lunate, then you have a capitate. Lunate dislocation you call when radius and capitate are same but lunate got dislocated. But if the radius and lunate are stable, but all the remaining part is being moved out, that is the capitate and the phalanx has moved out, then you call it as perilunate dislocation. Super duper question. I am in love with the examiner for this question. Excellent. Now, whenever the person falls on an outstretched hand, you all know Colles fracture, how does it occur? Radius fracture. Outstretched hand is a very common way that you will fall down. Then, where do you find fallen fragment sign? Typically, whenever there is any bone cyst, inside the bone cyst, if there is any pathological fracture, that fragment of that fractured segment of the bone appears like a fallen fragment in that aneurysmal, in that bone cyst is called fallen fragment. Favorite old question, this is also. Everybody will answer this. Those who attended minimum preparation. Then you are an intern and a patient with fracture. What is your first priority? What kind of finding is your priority? If your finger or patient's finger is blackened, please call the PG, right? Be very sure. That means there is no blood supply, gangrene is impending. Rheumatoid arthritis, it is the macrophages which destroy the synovium. They are the main central theme of the pathophysiology of rheumatoid arthritis. 8th and 9th costal cartilages, easiest question. इसमें दम नहीं है. ये तो synovial joint है. Nobody will think 8th and 9th rib is costochondral or a costovertebral. I don't know what examiner want to ask exactly. But ball and socket, hinge joint, saddle joint, ellipsoid joint, pivot joint. One of the joints, which variety is this joint, is a regular question examiner will ask whenever you go to for PG medical exam. Tom Smith's septic arthritis, where do you find? Typically in infants, whenever there is any septic arthritis, that will completely destroy the head of the femur and that will get displaced, and it is easy to move, telescopy positive, and often confused with congenital dislocation of hip. That's called Tom Smith's arthritis, a destructive arthritis of the hip in case of infants. Which is the last fontanelle to close? Anterior. Posterior closes by 2 to 3 months after birth. And the anterior fontanelle will take at least 2 years, second birthday, before it closes. Leschnyhan is HGPRT. Indradhanush mission. This is a beautiful question. One of the old questions. Measles, polio, pertussis, tetanus, TB, diphtheria, hepatitis B. इनसे नन्हे मुन्ने राजू को बचाओ. That is Indradhanush program. You will be vaccinating against all this, which you should be very sure. Now, what is the one which is shown? The cerebellar vermis is completely elongated with a poor cerebellar development. It is Dandy-Walker malformation. The corpus callosum will be abnormal or absent. There will be a cyst and enlargement of the fourth ventricle, and abnormally formed cerebellum is very ill developed, and the brainstem is compressed. So this combination is called Dandy-Walker. Arnold-Chiari, Dandy-Walker. Favorite high yield topics. You have to be very sure. So this is normally, this is how the corpus well developed callosum will look like, ill developed callosum. Normal cerebellum ऐसा होता है, यहाँ cerebellum is missing. And normal brainstem looks like a nice bird with its beak, but this looks like abnormal compressed brainstem. That's what you need to remember. What is the most common cause for the neonatal blindness? It is the Neisseria gonorrhea, which lead to ophthalmia neonatarum responsible. How do you manage the shoulder dystocia while pulling out the baby? So you will flex the legs onto the abdomen, and that will cause the rotation of the pelvis. It aligns the sacrum and opens the birth canal. You apply a suprapubic pressure, right? And to the fetal anterior shoulder. So you should remember helper. H is call for the help, E for whether I can do episiotomy, L for McRoberts maneuver with the legs being flexed onto the abdomen, P for suprapubic pressure, and E for rotational maneuvers, and R for remove the posterior arm, and R is roll the patient to her hands and knees. Helper is what you need to remember. What is this ultrasound? Sorry, what is this hysterosalpingogram? It is a classical example of how a unique cornuate uterus looks like. So, this is a normal uterus and this is only with one cornu, unique cornuate. Within short time, you are all going to become top MD, gynops, DGO, gynops, so many things, no? So, be in the dream until actual results come. Dream is the only driving force of the human race. So, two horns is didelphys. Then you have a bicornuate uterus typically looks like this, and a septate uterus look like this. So what is true hermaphroditism? Ardhanarishwar hota hai Ishwar. So typically if you are having both testis and ovary, most commonly karyotype in them will be 46XX. This is very rare type of situation. Most of the times you find pseudo-hermaphrodites, like congenital adrenal hyperplasia, right? Pseudo-hermaphrodites. But here you find true herma means you have one side testis, another side ovary. Peripartum cardiomyopathy, it can develop any time within the 5 months, be very sure. Nerve commonly compressed in pregnancy, lot of times labor and many things, you will be stretching the lateral femoral cutaneous nerve and femoral nerve. So femoral nerve is the most common thing that get injured in pregnant women. That's the reason frequent position changes should be done, and you should avoid prolonged hip flexion, and also you should decrease the pushing time, and you should allow the passive descent of the fetus, right? Lot of midwives over stress on push. So be very sure to not injure. Pregnancy may thyroxine binding globulin levels will increase. And why? Because pregnancy is a hyperestrogenic state that will increase TBG production. TBG will decrease all free thyroxine is getting bound with that high TBG, and because of that there is less amount of free T4 available. That stimulates excess production of TSH, and that in turn will lead to increased production of thyroid hormone. So this is the typical physiological changes of normal pregnancy. Paget's disease typically involves the vulva, where the labia majora is the one which is involved with Paget. Superfecundation means what? Typically one after the other, two acts of intercourse, two sperms have fertilized two different ova and produced two children. If the two sperms belong to the same man, it's okay. But if they belong to different man, then the two twins born will have different biological fathers. That's called superfecundation. Fetal heart, when do you start looking at it? 3 to 5 weeks. Another routine question on the Doppler. Cesarean section preeclampsia may be most preferred one is epidural to be given. High risk pregnancy involve everything, but earlier manual removal of placenta is not, most of the labors require manual removal of placenta. So that does not constitute a high risk definition. Now in preeclampsia, we don't use etalol, we use labetalol, hydralazine, methyl-dopa, etc., etc. Dilatation and curettage, we don't do in PID. And one of the predisposing factors for the pelvic inflammatory disease is dilatation and curettage. Placenta has got 2 arteries and 1 vein. इसलिए you call single umbilical artery. but it has got a Wharton's jelly is what you need to appreciate. When do you see acute fatty liver? Third trimester. If you look at the high yield topics, invariably one question comes on intrahepatic cholestasis of pregnancy, pruritic papules and of pregnancy, fatty liver of pregnancy, fulminant hepatic failure of pregnancy, hepatitis B of pregnancy, HELLP syndrome. In all the scenarios wherever the liver is involved, one topic invariably comes. You have to be sure. So nausea, vomiting is very common with fatty liver. Jaundice follows in 1 to 2 weeks. Common differentials are preeclampsia, cholestasis, viral hepatitis. Why preeclampsia, HELLP is a differential? Because this also occurs during the last trimester. It will usually resolve after the delivery. Mainly you should stabilize the mother. And typically there will be hypoglycemia, coagulopathy, encephalopathy, etc., etc. Now, feto-placental circulation, how much time does it take to establish? So you must know this timetable. 2 cell stage 30 hours, 12 cell stage 72 hours, blastocyst 5th day, and by the time feto-placental circulation establishes, it takes around 3 weeks is what you need to basically remember. Pomeroy, Uchida, Maidlaner, Kroner, these are the favorite. One question will come on tubectomy, right? So in Irving, Pomeroy, Parkland, Maidlaner, none of the situation you will cut the fimbria. Fimbriectomy is only done in Kroner. What is the difference? Pomeroy, you will do a loop and then you crush. Then in Irving, you will basically make it to get embedded within the broad ligament. Then in Parkland, you will remove it, you won't make a loop like in Pomeroy. So this is how the difference. Image based questions make commonly one question on tubectomy they will ask. RDA of iodine. How many RDS you will remember? But RDA of iodine is definitely a crackable question, not an impossible question. Now postpartum hemorrhage. Retained placenta, endometritis, fibroid, undiagnosed CS cervix, postpartum infection, they all can lead to development of postpartum hemorrhage. When you want to do quadruple test, 15 to 20 weeks. So AFP, estrogen, HCG, they are all the ones which you test. So trisomy 21, 18, 13, what is the differences between the various parameters? You have to be very sure. This table is a favorite area every time they ask a question. Fetal lung maturity improve करने के लिए what do you use? You use dexamethasone. You all know very that. Typically there is a bleeding and what do you find? Big lumps. Typically it is a case of leiomyoma. No challenge in that question. Uterine prolapse में vaginal pessary लगाए तो how are you sure that you have rightly placed it? You ask a woman to apply abdominal pressure if the pessary is not falling down. That means you have rightly placed. That's the way you check it. Where do you give hormonal therapy? Hot flashes are the ones which are considered to be due to estrogen deficiency where hormonal therapy will help. Murphy's sign. Our anesthetist's favorite question, it used to be in the ward rounds. So what is Murphy's sign? जब भी आप endotracheal tube देखे तो लास्ट में एक स्मॉल होल होता है. क्यों होता है? So whenever you happen to pass the endotracheal tube, if the main opening is blocked, whatever be the reason, some structure came, you are abutting, you passed it, some people बहुत tension में घुसाते endotracheal tube को, ultimately it will go into the, just not trachea, it will go all the way into the bronchi and completely occlude a lung also. So that's the reason, don't push it and kill the patient, right? You should rightly make it to reach until the trachea. If he occludes also, this small hole called Murphy's eye will help you to get the air pass. That's called Murphy's eye. Mallam Patti classification. The moment patient opens the mouth, when you want to do the endotracheal intubation, you should see, can I see the uvula, can I see the tonsillar fossas, everything. So accordingly, you can see soft palate fossas, uvula, pillars also class 1. You can't see the pillars, class 2. And you can't, you can only see the soft palate and base of uvula only, then you call it as 3. Only soft palate not visible at all, then you call class 4. To know how difficult is going to be intubation. How do you know whether anesthesia adequate or not? Typically it is a median nerve block, and the lateral aspect of the ring finger is the one which is basically evaluated to know whether anesthesia is adequate or not. A question on Mapleson systems, without that there is no question paper. आप देख लो anesthesia में top 20 topics क्या होता है, यही होता है. And this is one topic always used to irritate my gut. Never comfortable with this topic, right? So for the spontaneous respiration, you should know what are the advantages of one type of Mapleson versus the other type. Now for the curanium drug, how does it act as a muscle relaxant? It's a competitive inhibitor on the acetylcholine receptors, as all of you know very well. So what is this lesion? Typically this lesion is called as a Becker's nevus. Impossible question. No one can answer this in real exam hall. It is a late onset epidermal nevus or a birthmark occurring mostly in the males, which is basically called Becker's nevus. Don't worry. If you answer this wrong, don't spoil your sleep. Very difficult to answer for many. Cutis marmorata, typically in the newborn child, if he is being exposed to the air conditioning of the intensive care unit, suddenly he will develop a appearance like a fish, which is called cutis marmorata. It's a reversible situation, nothing to worry. Once more you warm the baby properly, he will become alright. Child has an asthma and a lesion like this, which is suggestive of allergic contact dermatitis, especially asthma history is the one which is suggestive. Esophageal perforation, to detect it, you look at the leakage of the barium sulfate, is considered to be a safe radio contrast agent you can use to detect. What is meant by Bragg's peak? So whenever the protons or alpha rays or other ionic rays pass, then they basically lose some of their energy, and that energy loss is detected on the Bragg's peak. So highest amount of energy loss will be there the moment protons are emitted. Another challenging question on radiotherapy. I don't expect you to answer this. Salt and pepper hyperparathyroidism, even a newborn child in NICU will answer it. Then uterus anomalies are detected with the hysterosalpingogram, MRI guided HSG and ultrasound. You don't need a CT guided HSG. Spot radiograph of the double contrast image is showing lot of mucosal folds. This is called Herring pattern. Those who have reflux esophagitis typically will show the presence of this is also called feline esophagus. If you happen to do endoscopy, it looks like the feline skin folds. Cat ka skin folds rehte na, like that. So this typically occur in case of those who have the reflux esophagitis. In the MRI, this is the vein of the Galen that you can see, which is typically, where do you find the vein of Galen, doc? It is at the confluence of the straight sinus and sagittal sinus. This is the area where vein of Galen enlargement can be seen. Now in the image, whatever you are seeing is an example of a unicornuate uterus.